1 in 8. Ladies, those are your odds of hearing the words cancer. And who isn't touched by this disease? It strikes women and men of every age, race, and income. And even those on the front lines of treating breast cancer aren't immune.
All day, every day.
That's a big mass that she has.
Dr. Deepa Halaharvi, a surgeon with OhioHealth, treats her breast cancer patients. But this time, that devastating diagnosis was given to her.
So you know what it's like to sit in that chair as a patient.
Oh, for sure.
At 42 years old, facing invasive ductal carcinoma, the most common type of breast cancer, picked up on her annual mammogram.
What if you'd waited?
If I waited till I was 50, I would have died. Yeah, I would not be here.
Dr. Halaharvi never saw it coming, and who does? Young, no family history, married with 2 young children to raise.
You think about your kids. The first thing I ask my partner is, am I going to live long enough for their weddings, you know?
So this doctor became the patient, had a bilateral mastectomy, and the doctor she practices with, who trained her, performed the surgery. Her odds were excellent, with a survival rate of 95%, but it did not keep her from worrying.
Did you shed some tears over this?
A lot. A lot.
And those tears, the worries, gave Dr. Halaharvi a deeper understanding of what her patients go through.
I for sure feel very blessed and very grateful that I've had the cancer, which is very weird to say. I call them as soon as I know, like the minute I know. And when they cry, I just want to reach over the phone and give them a hug because I know how that feels. You know, I can feel the pain.
It's a pain and a fight she carries with her every time she shares her message. Early detection and mammograms save lives.
As a physician, I was so busy, I was putting it off, getting a mammogram, and I want to tell women, you know, this is important for you, for your family, for your kids.
And screening mammograms are something she is so passionate about. There's been some confusion over the years, some
50.
controversy. Exactly. But the American Cancer Society stands by their recommendations of starting mammograms at age 40, earlier if you have a family history of breast cancer. It is that early detection that she is confident saved her life.
Absolutely. Now, this happened just last March, so what's the latest? How is she doing now?
She's doing great. She is back to work, and she's sharing her message. She goes out there, and she's a survivor now. And she's going to tell everybody, too.
She's got a deep empathy, obviously, now for her patients, which I think also helps.
She feels like she was meant to go through this.
Wow.
That's pretty
Very good story.
Oh, thank you.
Very nice.